second episode of the Siyaphambili webinar series, which is called Understanding Capabilities Amongst Young People in Global Settings. I'm very glad to be here with you and look forward to a very good discussion around this very interesting topic. We're going to have quite a structured format to the webinar in the interest of time. So we'll begin with our panelists presenting their work. We'll then pass on to Julia Greco, who will provide some insight on both presentations and some overall reflections on research in this area. In the meanwhile, please do put your questions for our panelists into the chat box. After all panelists have spoken, we'll move into a session where we will be able to answer some of your questions. Please be aware that this session is being recorded and it'll also be available on the Siyaphambili Youth YouTube channel, as well as the other webinars in case you've missed them. We're really excited to have you join us today. Please do remember to introduce yourself to our colleagues in the chat box, and please do type in your questions into the chat box at any time during the webinar. We will make sure that they're addressed after all panelists have spoken. This series of Siyaphambili Youth webinars explores critical themes in global health. And today we're going to be focusing on adolescent well-being and capabilities amongst vulnerable populations. In 2020, the Siyaphambili Youth Project was launched in KwaZulu-Natal in South Africa, and it aimed to investigate the impact of marginalization on young people's well-being, and also to develop strategic interventions to tackle these issues. This particular episode, which is episode 2 in the series, will delve into measuring capabilities amongst vulnerable populations in low and middle income countries to better understand the valued aspects of individuals' lives. Experts believe that a nuanced understanding of these aspects can help us better understand the impact that interventions can have on individuals' well-being, and it will allow us to design more equitable interventions, especially in settings where resources can be constrained. So without further ado, I will hand over to the first of our panelists, Gerard Abujaude, who I have the pleasure to work with at the UCL Institute for Global Health. Gerard is going to be presenting from his PhD work, which is conducted in rural South Africa. And over to you now, Gerard.
Thank you so much, Naya. Hi, everyone. So as Naya said, I'm a research fellow at UCL, and I'll be presenting work from our project on the Enabling Schools project in rural South Africa. I'm hoping you can see my screen here. So we did work with both adults and children to conceptualize what was important in their lives and define well-being with them, and then try to come up with a set of measures within that. And today I'll be focusing primarily on adults. We have a very short space of time to speak, so please excuse me if I skip over any salient details, but I'd be happy to answer any questions at the end. We did some work with populations in Mahikeng, which is in Northwest Province. And the vast majority of adults were of Setswana background. There was high levels of unemployment, although it should be noted this was carried out during COVID. But they were largely representative of the wider provincial population. And then we, as well as the adults, we then did some work with the children that they were either primary caregivers for or responsible for. So we got together with the participants, and we had one single aim, both for the adults and the children, and we asked them what made a good life for them. And the way that we tried to get to an answer for that question was by giving each group, both adults and children, a camera that they could then go and use to take pictures of what was important to them and what made their life either good or bad. We then used those pictures that they took we asked them to select the 10 most important pictures that they thought out of all of the ones that they took they'd like to discuss. And they put together these posters that you can see in the pictures over here, and ranked them from most to least important. We then had focus group discussions in groups with both the adults were larger groups and children were much smaller groups of about 3 to 4 children, because the needs are different, obviously. So these pictures then formed the focus group discussion guide. I'm not going to spend very much time with the adults because the focus here is on youth, but it's just to give you an example of what an individual poster looked like. And each of the individual posters that were put forward, the group then selected one picture from each individual poster to discuss. This was for the adults. And there had to be consensus on it. By doing this, through both the pictures and the focus group discussions, we achieved quite a lot of depth in the data that we gathered, and we organized them basically thematically, based on the types of responses and discussions that were made. And we came up with these broad themes on the left called topic, that I've provided examples for the adults. And between all of these topics, these constituted what they thought was important, most important, for a good life. So I'll focus on the main part of the presentation, which is around children. And we found that photo voice enabled the children, particularly those that we were working with, some of whom, for example, couldn't write yet because this was children between 6 to 10 years old, but some of them had, for example, these descriptions written on for them. But photo voice enabled greater participation by the children because there weren't the types of language barriers that they might face with traditional forms of interviewing or, for example, asking them to write a creative essay or something. And in general, the children identified a pretty large group of dimensions that were important to them. And they aligned with some of the previous work that had been done by people like Mario Bigeri in Nepal. But there were also differences quite context specific to the setting in South Africa. So some of the most important things that children thought were essential for well-being. A lot of it revolved around play. A lot of it revolved around safety and feeling both cared for adults and having people to care for, like siblings. But some of it was around the community. So some spoke about, for example, loving their dogs. So there's a extract here that I've provided. So the interviewer was asking, tell me about the dog in the picture that you've taken. And the child said, because it helps me. How does it help you when thieves enter and bite them? So there were both positives and negatives that were highlighted through these interviews. And primarily some of the negatives were around safety in terms of the roads and the community, both alcohol and crime, and not being able to go out and play freely through fear of injury or violence. And there were also more commonly as well experiences of violence both at school and the home, which seemed to affect the children overwhelmingly in terms of the barriers. So this was either verbal abuse from teachers or kind of physical abuse, both at home and elsewhere. But they were able to identify, as we can see here, a rich set of activities or dimensions that they thought did make their life good. And so we took this And we mapped it to try and see how schools specifically impacted on their well-being, to try and see the types of policies in the local municipality that were bringing positive aspects to their lives, as well as those barriers or dimensions that were actually doing the opposite. So they were having a negative impact on their well-being. And so broadly speaking, if we take education, access to food, physical, mental health, safety, dignity, and respect, and then their future prospects, we found that there were many policies that were highly valued both by the adults and the children. So around the focus on reading and writing locally that was provided. This was seen as a huge dimension for empowerment. Buses for safe transportation that got rid of a lot of the problems that the older adults had when they were growing up to try and get to school, as well as communally led activities. So not necessarily policies, but these were kind of grassroots activities such as school gardens, or land use that provided additional income for the school, so children could get involved in planting and tending to these school gardens along with the adults, which were then used for additional income by selling them on and so on. So there's a whole host on the left that were enablers to well-being, as well as the barriers, which primarily revolved around people perceiving certain things like wastage and inefficiencies as patently unfair. The fact that there were, for example, tables and chairs available for children to have separate tables and chairs at some points, but because of mismanagement or inefficiencies, they were left outdoors and could no longer be used because they were damaged, as well as certain aspects like bullying and interpersonal relations, which were to do with the school atmosphere. And all of these aspects in terms of barriers could be areas for intervention that could result in more improved well-being. So all of this was achieved by simply giving cameras and then discussing the pictures afterwards. The main aim when we came across was not only to get a nuanced and rich data set, but also to try and come up with a measure that could then be used within the project in order to measure well-being, both at the start and at the end, to try and establish whether the project had an impact on well-being. And when we were looking for the types of measures that we might be able to use, a lot of them were developed in high-income countries, which is what motivated us to do this work, because not all of them map necessarily well to the local lived experience and what mattered to children and adults in Mahikeng. So the end result was a lot of detail on the types of policies that might have an impact, and quite clear models of what constituted well-being and what could improve well-being in the area. What we did not achieve was the ability to generate a measure, particularly for the children, that would meaningfully be used in something like an economic evaluation or impact measurement of the project. And so this led me to these conclusions to wrap up, which is that photo voice and this kind of qualitative research provided very rich data, and it has a whole host of uses, and it was presented to the Department of Basic Education, so it's not to undermine the work in any way. But there are various challenges which we came across to develop usable measures, either for impact or economic evaluation, that were both locally relevant, but could also be standardized and compared more widely within South Africa or across contexts if required. And the reason for that are certain things like weighting between the different dimensions, and the amount of data that would be needed, for example, to do some sort of data-driven approach. And with the younger children, how meaningful that might be. So the one question I thought the one concluding question that came out of the research was, could something like a very simple approach where we ask someone to say how satisfied they are overall with life be an alternative to multi-dimensional measures that might get quite complex? And most recently, I think in 2020, the UK Treasury advocated the use of something called wellbeing adjusted life years. So this is the idea that we can have a unit that represents one unit of well-being, and they recognize the possibility of using an overall life satisfaction questionnaire between 0 and 10 in order to derive and estimate these well-beings. I'll stop there. Thank you. Have I gone over time, or am I okay?
Thanks very much, Gerard. That was a really fascinating presentation. A gentle reminder to everyone who's joined us that if you have any questions or comments on Gerard's work, please do drop them into the chat box, and we will have a chance to discuss them in the Q&A sessions after everyone has presented. I'd like to invite our next presenter now, Noni Bengu-Simelane. Noni is a research fellow and early career researcher at the Gender and Health Research Unit at the South African MRC. And Noni is going to be presenting on work that she and I and several people who've joined us today have worked on together. So over to you now, Noni.
Thank you, Niha. Greetings, everyone. Hope everybody can see my presentation. Okay, so my name is Nonhlonipho Bengu-Simelane, and I will be presenting on my work that we did here in South Africa on developing a capability.
Noni, I'm sorry to interrupt you, but we can't see your slides at the moment. Would you mind sharing?
All right. Okay. My apologies for that. Can everybody see them now?
Yes, we can. Thank you.
Okay, thank you, Niha. All right, my apologies for that. Greetings, everyone. My name is Nonhlonipho Bengu-Simelane, and I'll be presenting work that we did here in South Africa, developing a capabilities-based measure for young people at high risk of HIV. Okay, so I will begin with a brief introduction to the capabilities approach and its measurements, and an overview of why we wanted to understand capabilities within the Siyaphambili project. And then I'll present the method that we used, the results followed by the discussion. Okay, so an individual set of capabilities refers to them having access to resources to improve their well-being. And individuals should be able to make and act on choices that matter to them. People may not have the same ability to convert a set of resources into equal states of well-being. So if policies do not take these differences into account, they may equalize resources among people. And that is why it is important to have a comprehensive assessment of well-being. And people might just, marginalize particular groups. So it is necessary. To understand what people value, in addition to the accumulation of material goods and commodities. So the capabilities approach captures such personal, environmental, and institutional variations providing a more complete picture of individual well-being across general and the vulnerable.
Nani, I'm sorry to interrupt you again.
Yeah.
We can see your slide, but we
It's not
can't
moving.
see the slides move at all.
Right.
And it's not in presenter view, so the slides are quite small.
Okay, let me try and do this now. Okay, and now?
No, I think you might need to put it back into presenter view, and then you should be able to transition.
All right.
Yes, we can see the slides now.
Okay.
Thank you.
Right. Okay, so capabilities are subject and they're not straightforward to measure. Existing surveys such as the demographic and health survey have collected data on several dimensions of an individual's capabilities, but not all, and thus do not offer a complete understanding of an individual set of capabilities. They are lengthy and they are time-consuming to administer, and they place a large burden on both respondents and the interviewer. So Cost and colleagues made the first attempt to measure an individual's capabilities with their two surveys called the ICECAP-O and the ICECAP-A measure. So capabilities for older people and the general population in the UK respectively. So these tools are concise and they're simple to administer. So the structure of these tools offer an advantage in resource poor or low literacy settings, and their brevity may make it easier to integrate into larger data collection systems of trials. So these tools have been validated for use in high income settings such as Australia, Canada, the Netherlands, and other countries, but only a handful in the low middle income countries, such as Iran and China. There have been other attempts to measure quality of life in the sub-Saharan Africa, but those have only been done through formative work in Malawi. So, and they only focus on the general adult population, but not testing the appropriateness amongst the vulnerable populations. So okay, so they are jumping. So despite expanding HIV treatment in South Africa, HIV acquisition is a major challenge, particularly amongst out-of-school young people ages 18 to 24. And in KwaZulu-Natal, there is a high incidence of HIV in communities with already a high HIV prevalence in urban and rural settings. Therefore, developing an effective HIV prevention intervention for young people remains a major priority to reduce the overall burden of ill health in Africa, in South Africa, and globally. So against this background, the Siyaphambili Youth Project in KZN aims to establish a causal understanding of how contextual factors shape HIV acquisition risk among young people, and to develop and pilot an intervention to reduce HIV acquisition risk amongst this vulnerable population. So in this setting, we need to consider differences in level of capabilities that young people may have in different social, economic, and cultural settings that help them mitigate these risks. Thus, developing a context-specific measure to capture young people's capabilities in this context is important to understand the impact of the intervention on overall well-being of young people who are at risk of HIV acquisition. So this study was conducted in Durban, and which was the rural site, and rural KZN near the Mozambique border. For data collection, we conducted focus group discussions with young men and women. The discussions were structured around what is important in a young person's life to have a good life, the things and the experiences that they liked and disliked, what brings them happiness, satisfaction, and how these things may be achieved. So these focus group discussions were recorded, they were translated, and and transcribed verbatim. So the data was analyzed thematically. We first used inductive methods to generate themes and sub-themes that illustrated the attributes of a good life for a young person, followed by the use of deductive methods to conduct a structured analysis of the FGDs and the data within the framework of attributes that is captured in the ICECAP-A tool. We then conducted follow-up workshop discussions with two groups, urban men and women, and then to validate these findings from the first set of FGDs, participants were asked to reflect on their own lives and the relationships with people, and discuss whether these attributes emerging from the first set of FGDs were important to them to have a good life, and why so. So following this open discussion, the participants were presented with a summary of findings from the first set of FGDs, and they were asked whether they agreed or disagreed with these, and whether they thought that other young people like them might feel the same way. So we undertook a narrative synthesis of the workshop discussion and compared the findings to those of the FGDs to validate the initial findings. So we used the findings from the FGDs to adapt the ICECAP-A tool. We translated it into English and isiZulu, and then we conducted cognitive interviews with a total of 16 participants, 8 from each site. So this helped us establish how questions are being interpreted by the participants and how they are being answered. This also helped us understand whether the final tool adequately reflected the nuances of the included attributes that emerged from the FGDs, and the analysis was done using NV412. So in the FGDs, 8 themes emerged, and the first 5 themes were mapped to those under the ICECAP-A survey. And then 2 new themes that I've highlighted here in green also emerged strongly from the FGDs. The first was the feeling of safety. This was highlighted by women in the urban and rural areas. The feeling that they were unsafe from crime and assault impeded their independence, and of them feeling safe. And then the second one was of respect. So the second theme of being respected by family members and people in the community was important for them to have a good life. So participants also mentioned that feeling safe from judgment from others was very important for them to have a good life. So we validated that data with them, and then they didn't suggest that we should add any other themes to the survey besides the 2 that we discovered. So then we added these 2 additional attributes to the tool and created 2 versions, which is in isiZulu and English. The surveys were self-administered to 16 participants, and then completing the surveys took approximately 5 to 11 minutes. And then the participants reported that the survey was easy and the questions were straightforward. Okay, so the attributes of a good life amongst the young people or this population. So the attributes of a good life amongst this population mapped onto those that are on the ICECAP-A survey. And then we added these 2 specific new things that emerged. We also think that it is worthwhile to consider context-specific dimensions to assess well-being, especially when we are looking to influence context factors that affect health and other outcomes, and then also comparing the baseline and the end-line data from the RCT pilot of the intervention will enable us to evaluate the success of the intervention, which aims to reduce young people's HIV acquisition risk. And then we also think this is very important, especially if interventions have a spillover. So this is just the survey that we used, the ICECAP-A tool, with the 2 additional themes that emerged from our cognitive interviews. Thank you.
Thanks very much, Nani. I'd now like to invite Dr. Julia Greco, who is an associate professor in health and wellbeing economics and based at the London School of Hygiene and Tropical Medicine, to reflect on both these presentations and comment on perhaps some of the challenges of measuring something that's so subjective, but also why we might want to do this in a health and well-being intervention evaluation. And of course, Julia, it would be great to have some insight from you on way forward, perhaps reflecting on some of your own work in this area. And you've done some of this work for over a decade now.
That's quite scary. Thank you very much, Nea. Thank you very much, Gerard and Noni. It's fantastic presentations. You managed to keep to the time and yet give a lot of information and a lot of food for thought. So congratulations on your work. Very interesting. And that when you actually hear it, is even richer than when you read the slides beforehand. So just a couple of points for reflection. I think that the two presentations, they do really much complement each other, the two type of work, because so Gerard was very much a bottom-up, led by the participants to express what is a good life in their own terms, at their own time. And there is this great combination of the individual expressing their own perception of a good life, taking their own pictures, how they want them, with the subject they want, and then they chose the pictures individually. And then there was the sort of public debate, the public reasoning that was done as a group. So that fits in very nicely with SEN framework, that is capabilities are very much individual, but then you need to go at the community level or at the general level to have sort of public debate and verbal reasoning, as he says. So that was a very nice combination, because you have your own, but then you need to have the perception or the approval from the group, which it was done very, very nicely. While in Noni's case, it's of course it's a ready-made measure, the ice cap off the shelf, which is nice. It's neat. It's 5 dimensions, very quick. Although some of the questions, how they're phrased, I find them quite challenging, even for a UK context to answer. And it's great that you've done this amount of work of cognitive debriefing to trying to understand if this measure fits in within your context. And then you ended up adding 2 extra dimensions. The issue that might rise is if you start, so a lot of measures like the EQ5D, 5L, they will never allow you to change, not even a comma. So because a measure needs to be as it is to make it comparable across the countries. However, today, for example, I discovered that UNICEF has developed a new measure for adolescent well-being that is a combination of mental health, also mental well-being for adolescents, and they allow countries or contexts or studies to actually adapt, change the translation. And so they are moving maybe away from that very restrictive Euroqual style of having a very prescriptive measure that you cannot change anything, to actually being a bit more flexible, add some questions or rephrase some questions. Although then there is this discussion of if you have a ready-made measure, then you might, why don't you just end up using it like that? And then maybe you complement with or triangulate with extra qualitative work or adding other questions, but then you analyze them separately. So you have your index, and then you complement with extra question. I think that even perhaps the Euroqual was adding questions, or there was discussion of adding few things, for example, to address equity or others, so that you can compensate. But also, so if you have a ready-made measure, an index, it's, of course, you can compare across countries. The question is, do you really want to compare across countries? Because maybe it's actually you don't want to do that. you might want to, while a dashboard approach, as more in the case of Gerard, could be a dashboard approach that actually could be more interesting, like the OECD Better Life is a dashboard. They do a Better Life Index, as they call it, but you can also end up just using the dashboard, or like the Sustainable Development Goals. They're dashboards, and you track your progress according to different aspect of your life, and also that is actually very interesting. So you could use both. I also wanted to add on the beautiful consideration that I thought about, the beauty of having this list of capabilities, that at the end of the day, if you really unpack them and you go to the core of what they describe, there is a lot of overlap between the different contexts and countries. So even so for my work in Malawi, as Nea mentioned, it was with women's in rural areas, women's of reproductive age, and they came up with very similar lists to their adolescents in South Africa of being respected, not being their appearance was very important. What struck me, for example, it was the shoes, Gerard, that you mentioned. Having shoes, it's not just because you need shoes. So it's not just the fact that you have shoes, it's the fact that you have shoes so that they're not going to bully you. And in Malawi, for example, they mentioned to have a cloth line, a line for hanging the clothes and having the clothes. It was like, why do you need a line? So was it's just, you have a line, tick, you have a good life. It was because you needed, if you have a line and you can hang your clothes, it means that you have more clothes, you have spare clothes, extra clothes. So you are actually well off. And everyone in the village will see that you have an extra pair of clothes. So you're rich. So it wasn't an actual, and it very much fits in with Sen theory. It's not the commodity that you possess. It's not the fact you have the shoes. It's not the fact you have the clothes. It's the fact, what can you do with that? Okay, with shoes you can walk and everything, but also because they're not going to tease you. You are going to be respected. You're going to stand out because you're well off, you're well mannered. And all of that very intangible and very hard to measure aspects that the capabilities approach is able to capture. So it can be phrased in different way. Or for example, the safety of being able to travel on a bus. It's not just having a bus, it's being able to move freely, to being able to go to school, being able to move in a safe environment, which is and you can phrase it in different way, but the core concept is being able to access the services with transport, but also with to overcome barriers, even gender barriers to access education, for example. So you can unpack and go on and on to the very core, and the very core is common to many, many different contexts. I was very intrigued about the treats, and what are the treats? Gerard, you mentioned the treats. And kids, of course, it was beautiful that they said that treats is a good life, which who wouldn't agree with that. But what is it about the treats? Is that where they bring you joy? Of course, yes.
Oh, it was because we did ask. It was because usually it's the day they spend with their parents or their caregivers, and so they typically get them a treat. I mean, this is when the children mentioned, I enjoy spending time with my with caregivers. Treats are the best part of my day. So it's more about
So I think that moving beyond the actual commodity of the treat per se, which of course brings you immediate joy, but it's the fact that the treat means that you're going to spend time with your family. And that's the recurrent aspect of having which is very important, is in some measures, like, for example, the EQ5D, they see the individual as living as an individual soul in isolation, while something like the capabilities approach, even as IceCap or with a dashboard, they really put the individual in a relational context. So the child is enjoying treats because that means spending quality time with their parents or in a school level. So it's the relational aspect. It's not, you're not happy just because you're happy because we are all together. And that's beautiful aspect of the relational well-being. It can only be captured with the capabilities approach. It cannot be captured with a standalone measure of a traditional health economics measure. And I would raise some concern with the well-being as well, because for adolescents, we know very little about life satisfaction and happiness and what they consider as important when they evaluate their life. And so I would try to to stick with the capabilities, and because happiness and life satisfaction, I wouldn't feel comfortable of restricting into one evaluative assessment or your own life, because of course you're missing out on the value judgment of the community. Is just what suits you, but you don't have that consideration of what do people think, that what is important? Is everyone agreeing on what is important? You will make your own judgment and you will be in isolation. So it's not about the relationship with others.
Could I just, sorry, because that was such a quick presentation that I don't even think I elaborated my thoughts particularly well. It was just, so the Wellbees was solely in the context of economic evaluations.
Yes.
And the reason, so not in terms of informing policy necessarily with the richness that you just described. And the only reason that actually came to mind was because we do a lot of work with ministries of health around defining health benefits packages. And a lot of the time, there is no data on cost and impact. And I was thinking, how can there end up being more economic evaluation data if that is a direction that policymakers are increasingly using in a way that they can go, oh well, okay, fine, we don't have any of this data in our own country, but country X, Y, or Z has done it, and we'll look at how transferable this might be to our context. So that is a very small bubble in which I think the Wellbees could be useful, but beyond that, I'm not sure. I mean, I agree with your
we are collecting data on subjective well-being, happiness and life satisfaction in many different contexts, because I think we know little, and it is extremely attractive. You have one measure asking how satisfied are you with your life these days, and you, when you come up with the judgment, you assess your life in that moment. You take a few minutes, go through your life. Are you happy with this? Yes, no, maybe. And maybe if we agree that that's the right measure, then it's super easy. It's one question rather than having like 75 questions. So, maybe we know too little at the moment on adolescents that we can use it, but it could be maybe. I just wanted to ask Noni one question. I would like to know from Noni if is the plan then to use the IceCap translated and with those extra two questions, is that the plan? And are the guardians of the IceCap happy with the addition, the +2?
Hi, yes, so yes, the plan is to use the 2 additional questions, especially because we are trying to make it context-based, because it actually speaks to the lives of the participants, and these 2 themes emerged from interviewing them, so we really thought that it was context specific and speaking to their lives directly.
If I could just add to that, because Nani and I worked on this together, I think, so we definitely along the lines that you said, Julia, the reason why we wanted to make sure that we didn't use an off-the-shelf measure that exists for a different population is because we didn't want to fall into a situation where we were imposing a value judgment. And so we started off with the qualitative work to understand what is a good life. And similar to what you found with your work in Malawi, there is such an overlap that we felt that the IceCap, because it's a shorter tool and it's easier to administer within the context of trials where data collection burden is quite large, that might be a good approach. What we haven't done, because we didn't think that it would have been an appropriate exercise, and this is what the IceCap team have done, is to collect weighting information. So we haven't done that. And rather than collecting weighting information, we will choose a slightly more data-driven approach to let the data decide how these are weighted. Because again, the young people that we're working with, while they have similar circumstances, there's also quite a lot of variation. And to just get an example of weights from them didn't seem to us to be entirely appropriate. So while we're using the IceCap framework as something to map this on, and there is an overlap, we wouldn't say that this is an extension of the IceCap as such. And we do need to think a little bit about how we formally frame this while recognize that we have been able to map it to the ICECAP dimensions, but it's not using it as an off-the-shelf measure and tagging something on and analyzing it in the same way, because it just wouldn't be appropriate in this context.
Thank you very much. Let's see if there is anyone in the audience who would like to add comments or questions.
There's one question that's in the chat, and we might give, we'll get to that, and we might give others an opportunity to ask questions as well. So I think this question would probably be good for everyone to kind of reflect on and think about and discuss. Is, what is the benefit of getting getting young people more involved in developing ideas and having a think about their own capabilities? And were there any surprises in what was identified by these different groups of people? This question comes from Andrew. So thank you, Andrew. Great question. Gerard, maybe you'd like to go first.
I was going to ask if Noni wanted to go first, or me. I don't mind. So benefits. I think they had very different views. So I didn't mention in the presentation that one aim we had was to try and compare what adults thought was important for children relative to what children themselves identified as important for well-being, for their own well-being. And there were definitely differences. So where adults thought discipline and structure were like the primary drivers of well-being and kind of almost getting a child ready for adulthood, children, as we know, were very much present in the moment, and what they valued were things like spending time with their parents. There were for sure overlap with, for example, where there are absentee parents, where you've got grandparents that perhaps struggling to pay the bills, that kind of shine through both with children and adults, because sometimes parents themselves have substance abuse problems, and that. So there were obvious overlaps, but there were a lot of areas, for example, what they enjoyed most about school that would not necessarily be obvious to either educational assistants or adults. Things around the importance of play and some of those things.
Thanks. Noni, would you like to share some of your reflections on what our participants mentioned? What was surprising, what you kind of had hypothesized they might say, and what was different?
Okay, thank you. Thank you for the question, Andrew. Thank you, Niha. So on my side, I would say that, doing this, being part of this research was very interesting for me, and working with the young people. And also, it was very, interesting to get a fresh perspective from the young people, because the young people bring new ideas and a perspective to the table, which can help, to identify and address gaps in the existing, capabilities. And also for the fact that we conducted cognitive interviews, I think was a really great aspect of the study, because we actually got to see how the participants really interpret and understand the questions, and hear their understanding, instead of assuming that they actually understand the questions or the tool the way that we understand it, or the way that we expect them, to understand it, especially looking at its context, specific. For example, the theme of respect and safety emerged when these questions were being asked in this setting, where else in the other countries, that I mentioned earlier during my presentations, such as Germany, and other countries, these themes did not emerge. So for me, that was very interesting. Thank you.
Great. Thank you, Noni. I can't see any other questions from colleagues in the chat. But if anyone does have any comments, any thoughts, that would be
Yes, there
great.
is a question from Alison.
Yes, Alison. Not a question, but a thought. Reminded of the newly launched set of 42 indicators to harmonize the measurement of adolescent health globally. Would be interesting to see how these complement and map onto each other. Julia, is that what you were mentioning?
No, this is another one, actually. I was talking
Okay.
about I am aware of this one, and that is also very, very interesting. And I have someone in my team is working on it as well. Also, it's very important. Yeah. Thank you for raising it, Alison.
So it's not global, but there's the Better Child Index, which I might try and map onto. It's like 10 dimensions that were, yeah.
Yeah.
Seems to be a lot of this work happening, which is great.
So the WHO work is not, so the big difference between the WHO effort on measuring adolescent health and well-being is, so they come from a functioning framework. So they use functioning rather than capabilities. So there's a fundamental difference. Although, of course, in the capabilities approach, it's not that you just measure capabilities, you end up also measuring functionings. If that is what is actually important, it's not just the potential of having a good relationship with your parents. You actually want to have a good relationship with your parents. So it's not the can you have a good relationship with your mom? You do have. So that's what it matters, right? But so they is how they are generated and how they are discussed. So there is what I appreciate a lot from WHO effort is that they're really trying to do a participatory community approach that is adolescent-led, that is really moving away from the traditional WHO approach of having a panel of experts, which are sitting in Geneva, coming up with a list. So actually they've been reaching out. So their effort is greatly appreciated, but it would be nice to compare. So every time you come up with a list or a dashboard, let's compare it with what's coming up, what's available, and recognizing that maybe you end up with the same type of lists, but the foundations of these lists are very different. So they come from very different processes and different actors that have been involved.
Yeah, that's true. I definitely agree. There is such an overlap, and not just, I think, in the terms of dimensions, but I think even when people are trying to explain what are the goods or the certain services that would be good to have access to. And Gerard, it was in your presentation, Julia, you mentioned it about your work in Malawi, and I've done work in Ethiopia with children of primary school age who said that it was very important for them to have shoes because it kind of gave them a sense of self-esteem. And so even with some of the examples that people use, there's such a huge overlap irrespective of the context. I just thought that was fascinating.
Yeah, backpacks in the UK.
Yep. School
it's always-
uniforms.
Yeah. And actually, on the other side, I would say a little funny story that we were living in Uganda and we went to Australia to visit some friends, and people were going to supermarket without shoes. So my daughter was so shocked because she saw those people walking in the supermarket without shoes. Thinking, oh my God, they're so poor. Would they go to supermarket without shoes? But actually in Australia, that's not a measure.
No, that's
socioeconomic status. Very
No,
much context specific.
very much so. So we're almost at time. I can't see any further comments or questions, so perhaps this is a good time for me to thank our panelists for their presentations, Julia for your comments and just giving us some food for thought, Andrew and Alison for very, very good questions and suggestions as well. So thank you so much for this. And I think our team is going to add a link to an evaluation form in the chat, and it would be great if you could take some time to fill this out for us. I'd also like to remind you of our next webinar, which is scheduled for the 12th of June, which is next week at 11 a.m. South Africa Standard Time. So please keep an eye out for this on social media for more information. For anyone who may have ended up joining slightly late or might want to watch a recording of this seminar again, it will be uploaded to the YouTube channel. So once again, thank you all so much for your participation, and we look forward to welcoming you to our next webinar.